This is Dr. David Pisetsky, Professor of Medicine and Integrative Immunobiology at the Duke University Medical Center, and I'm very pleased to have the opportunity to discuss briefly a recent review article that I was privileged to author on the pathogenesis of lupus. The title of the article is The Unique Interplay between Antinuclear Antibodies and Nuclear Molecules in the Pathogenesis of SLE. So this article provides an overview of pathogenesis, and while there's been enormous advance in recent years, what I'd like to do today is emphasize some principles. Some of these are quite venerable, but nevertheless they've stood the test of time and provide an excellent way of thinking about lupus pathogenesis. So I'll start with a very classic picture of lupus. This is the so-called LE cell, discovered fortuitously in the 1940s. Basic story is a bone marrow biopsy was performed of a patient with lupus. The slide was not immediately examined, and when it was, these cells were seen, and these had not been seen before. These are now called the LE cells, and much work was done to deconstruct the basic phenomena. It turns out what is the LE cell is the nucleus of one cell that has been engulfed by a phagocytic cell, mostly a neutrophil. But the key ingredient here is the presence of antinuclear antibodies, or ANAs. And this is basically how ANAs were discovered with this phenomena. So the principle, extracellular nuclear material, antinuclear antibodies, uptake by phagocytic cells. And for many years, this was used to help diagnose patients with lupus, but it really became the foundation of basic and translational research. And so these are the themes that were the legacy of the LE cell, and they are still valid today. The first are antinuclear antibodies. The second is the extracellular translocation of nuclear molecules. To get an LE cell, the nucleus has to come out of the cell. Interesting, one of the places where this happens is in the bone marrow, and the original LE cells were looked at in the bone marrow, but it also turns out that peripheral blood will also release nuclei. We always think of nuclei or nuclear molecules as intracellular, but in fact, they can become extracellular. Very important phenomenon. The next feature are immune complexes. Antibodies bind to the nuclear material. They form immune complexes. Depending on the setting, the complexes can activate the complement system, and that can promote inflammation, and that may happen in the kidney. The next is the somewhat unexpected finding is that immune complexes are taken up into other cells, phagocytic cells, but here the most important finding is the induction of immune activation following the uptake. A very important aspect of lupus is clearance. Clearance of nuclear material, clearance of immune complexes, and if these are either is not adequately cleared, then there's access of this nuclear material to peripheral cells, and as noted, immune cell function becomes activated after the phagocytosis of the nuclear material, and in particular, the interferon signature as a consequence of this uptake. So nuclear antigens, DNA, RNA, protein complexes, they have important cellular functions. As noted, they exit the cell, particularly during cell death. And perhaps the most novel and surprising result in the last years of research is that nuclear molecules are immunologically very active. This was not thought to be the case for many years, but now it is increasingly recognized. DNA and RNA are signaling molecules. Now, the activity as signaling molecules is enhanced when in the form of immune complexes. So the anti-nuclear antibody activates the immune cells following uptake. The reason these molecules are active is on the inside of cells. There are sensors for both DNA and RNA, and DNA and RNA are both constituents of immune complexes. These sensors are involved in host defense, probably against intracellular infection, maybe cell damage. The key event is the access of nuclear molecules to these internal sensors, and that in turn drives lupus pathogenesis by stimulating interferon. So a little schema I talk about, nuclear molecules start inside the cell, they get outside the cell, and they're taken up back inside another cell. Now, A&A production is central to lupus, but it's not uniform. And here is a very important finding, long recognized. Antibodies to DNA, one of the main components of antinuclear animals, they're markedly variable. They go up, they come down, and they essentially can disappear with conventional therapy. In consequence, antibodies to RNA protein complexes have a more stable production. That looks like they're being produced by long-lived plasma cells. Why is this important? Anti-DNA goes up and down. It's associated with nephritis. On the other hand, antibodies to RNP, ribonuclear proteins, are associated with interferon production. Anti-DNA is associated with complement activation, less true of antibodies to RNP. So although anti-nuclear antibodies are essential to lupus, they have different biologies. And what will be key is to try to define ways to eliminate or reduce anti-nuclear antibody production because they have such a central role in disease. So this is the schema, lots of data supported, and it gives a foundation to understand lupus as well as a perspective for developing new therapies. Thank you for your attention.